Welcome to the Invite Health podcast, where our degreed healthcare professionals are excited to offer you the most important health and wellness information you need to make informed choices about your health. You can learn more about the products discussed in each of these episodes and all that Invite Health has to offer at www.invitehealth.com/podcast. First-time customers can use promo code podcast at checkout for an additional 15% off your first purchase. Let's get started.
There are so many women who deal with chronic and oftentimes incredibly debilitating pain, and they may go on year after year dealing with this pain. So today I want to talk a little bit about endometriosis, what it is, how common it is, and different nutrients that may be beneficial. We certainly understand a lot more about endometriosis and the impact that diet can have on exacerbating this really incredibly problematic condition. So I want to get into some of the details and talk about what you can be doing, as we know that so many women are certainly afflicted with this condition. So I am Amanda Williams, MD, MPH, and it's estimated that close to 10% of women have endometriosis. And this is a really large number when we break down statistically. When you're dealing with 2% of the population, that's still a large amount. But when we say 10% of women in childbearing age can suffer from endometriosis, this is incredibly problematic. So understanding what exactly endometriosis is, it is from the endometrium, hence its name. And so metriosis is going to be the inflammation of that. So what happens is that when the uterine lining, the cells within the uterus, begin to grow outside of the uterus and can spread to other areas in the body where it does not belong. So most commonly, it's going to spread to places like the ovaries and fallopian tubes. But we certainly understand that endometriosis, this overgrowth of the endometrial cells, can start to go to places like the bladder, to the bowel, to the rectum. There are even cases where they have found endometriosis in the lungs, in the brain, as well as in the skin. And for any woman who has experienced incredible menstrual pain, they will probably attest to the fact that you just want it to go away. And this is one of the most common symptoms that goes along with endometriosis is very painful menstrual cramps. And the pain actually gets worse through the years. And so it becomes this chronic long-term pain syndrome. And for some women who have endometriosis, they can experience pain, when they're going to the bathroom, when they are, having sexual intercourse. There can be major issues when it comes to digestive problems, such as diarrhea and constipation, bloating, nausea. And this is obviously heightened during the menstrual cycle. We also recognize that there can be bleeding or spotting in between menstrual cycles. And we also look at infertility. This is usually one of the main reasons as to why endometriosis is diagnosed in the first place, is when women of childbearing age start to experience issues with fertility. And so they go in and they see a specialist, and then they're told, hey, you actually have endometriosis. This is why you are having the issue with trying to become pregnant. So when we look across the spectrum, we recognize that when it comes to, the risk factors for endometriosis, this is kind of wide open space. And we can find women from all walks of life who end up getting endometriosis. Now, we can also look at the dietary impact of this. We certainly recognize that low omega-3 intake in the diet, which we know is very common in the standard American diet, actually increases that risk once again. And they have done actual fatty acid analysis with women who have endometriosis versus those who don't. And they can find that direct correlation of having lower EPA, which is your good omega-3, comparative to things like arachidonic acid, which we know is going to be driving that inflammation. So we can look at, diet. We can certainly look at, other risk factors. There is a slight genetic component that is looked at in terms of a family history. Potentially women who have never had a baby sometimes are at a greater risk for the worsening of endometriosis. Certain exposures to pesticides also can be another causal factor when it comes to endometriosis. But we have to take a step back and say, well, what can we do if we know that we have endometriosis, or if you have a friend or family member or coworker who suffers from endometriosis? What is it that they can be doing? Well, first we have to think about those dietary and lifestyle considerations, and we have to look at that strong adherence to a Mediterranean diet with the higher consumption of high antioxidant foods, along with foods that are going to help to ease inflammation. So trying to avoid the standard American processed high sugary foods and red meats. We know that red meats are a direct link to that arachidonic release in the body. So we definitely want to limit that exposure. And we also want to look at, staying physically active. But then when it comes to different integrative or nutritional ways to target endometriosis, we have some really fabulous data out there that we know. Things like supplementation with omega-3 fatty acids, taking NAC, N-acetylcysteine. This is a real powerhouse when it comes to targeting endometriosis. And they have done studies that indicate that when they give women N-acetylcysteine, they actually see a reduction in those endometrial lesions, which is really very, very impressive. There was a study done in 2013 and published in the Evidence-Based and Complementary Alternative Medicine Journal showing, and they actually titled this, A Promise in the Treatment of Endometriosis, and looking at the reduction of endometriosis just from incorporating in NAC. So this was a 3-month study, and they were giving women 1,800 milligrams of N-acetylcysteine for 3 days out of the week. So just 3 days taking 1,800 milligrams of NAC. At the end of that 3-month time frame, they were able to see a distinct difference in the disappearance or the reduction of endometrial overgrowth, which is really very impressive. The other thing that was really profound within this study was that there was a group of women who actually got pregnant during this study because of the improvement of their fertility status just from taking NAC. So this is kind of one of those kind of go-tos for anyone who is dealing with endometriosis, is to incorporate N-acetylcysteine into your daily supplementation routine. Now, we can also look at things like resveratrol, and we know that resveratrol has been shown to once again reduce that number of endometrial lesions that are found spreading throughout the uterine cavity. And we can look at green tea. This is another thing. The power of EGCG coming from green tea has been shown to be very effective, along with vitamins E and vitamin C. So let's just think about this just for a moment. Let's say we know we have endometriosis, or we know someone who has endometriosis, and they start to take fish oil, for example. Then they say, you know what, let me start taking 1,000 milligrams or 2,000 milligrams of vitamin C every day. Then let me take 1 soft gel of the natural vitamin E. Let me make sure I'm taking my N-acetylcysteine every day. Let me make sure that during the day I'm sipping on the green tea TX. This can make a absolutely huge difference when it comes to the exacerbations of endometriosis as the menstrual cycle fluctuates from month to month. So there's so much that goes into the science behind these nutrients. And when we look at the pathophysiology of endometriosis and the inflammation and the driving up of the different prostaglandins and the hormonal imbalances, it's going to vary from one woman to the next as to, what is the main driving force. But the one thing that we do know is that a lot of this we can try to regulate or control via our diet, as well as making sure that we are getting those key nutrients into our daily routine. So knowing that we have a good 10% of women who suffer from this incredibly debilitating pain, there are things that you can be doing, and I certainly encourage you to reach out to one of our nutritional experts and inquire about this. Ask what nutrients would be most ideal for you in your current condition, as well as how much you should be taking them and when you should be taking these different nutrients. So that is all that I have for you for today. It was just a basic introduction of nutrients that can be helpful to support those who are dealing with endometriosis. And I want to thank you so much for tuning in to the Invite Health podcast. Remember, you can find all of our episodes for free wherever you listen to podcasts, or by visiting invitehealth.com/podcast. Now, do make sure that you subscribe and you leave us a review. You can follow us on Facebook, Twitter, and Instagram at Invite Health. And we will see you next time for another episode of the Invite Health podcast.